Good morning, I am Amal. I am from Professor Incupak's lab. Today, I will be presenting my work targeted nanoparticle delivery and releases synergistic photothermal and immunotherapeutic effect against hepatocellular carcinoma. Before starting the presentation, I would like to express my sincere gratitude to the organizers of the Horse and Biomedical Workshop for selecting me as an award recipient at this year event. So coming to my work, cancer arising from uncontrolled cellular proliferation continues to present a significant challenge to modern medicine. Although various treatment modalities such as surgery, chemotherapy, radiation are widely employed, they often lack tumor specificity. This limited specificity or selectivity can lead to substantial off-target toxicity and reduced therapeutic effect. To overcome these limitations, nanoparticles offers a promising avenue for achieving a controlled and localized approach in cancer treatment. For allowing for a more precise targeting of cancer cells while sparing normal tissues. So nanoparticle system used in biomedical research include polymeric, inorganic, lipid-based nanoparticles, which offering distinct advantages. Polymeric nanoparticles such as polymerosome, dendritic micelles, nanospace provide excellent control over size and structure. They can carry both hydrophobic and hydrophilic. Similarly, inorganic nanoparticle also can carry both hydrophobic and hydrophilic drugs, and even the lipid-based nanoparticle such as liposomes, lipid nanoparticles, and emulsions, which are highly biocompatible. These are also flexible in drug loading. Although some systems may show lower encapsulation efficiency, but together these platforms provide versatile options for achieving controlled release, prolonged circulation, and targeted tumor delivery. So this slide highlights the key biological event that nanoparticle encounter after intravenous administration. Understanding these steps is essential because they directly influence how effectively nanoparticle reach the tumor. So first one is protein corona formation. Once the nanoparticle enter the bloodstream, serum protein quickly attach on the surface, and this protein corona changes their identity and affect how cell recognize and interact with them. So the second one is MPS clearance. Macrophage, especially in the liver and spleen, can rapidly remove nanoparticles from the circulations. And third one is the third one is passive targeting. So nanoparticle may accumulate in the tumor through the enhanced permeability and retention effect, which occur due to leaky tumor vasculature. However, this process is non-specific and varies among tumor types. And the final one is active targeting. By attaching specific ligands to the nanoparticle, they can bind directly to receptors overexpressed on cancer cell. So this receptor-mediated interaction enhances tumor's uptake and improve therapeutic precision. So together these steps explain why designing FAT nanoparticle require careful control of surface proteins, surface properties, targeting ligands, and stability in circulation. So this slide is included because photothermal therapy is a central mechanism in this project. So PTT uses a near-infrared light to excite a photosensitizer, which absorbs the light and get excited and produce the heat, and so this heating increases cell membrane permeability, promote deeper nanoparticle uptake. So importantly, PTT can synergistically enhance the therapeutic index by improving nanocarrier accumulation in the tumor, strengthening the cytotoxic effect of the delivered drug, triggering drug release precisely at the target site. Together, these effects contribute to more effective tumor ablation. So this slide provides overall overview of a hepatocellular carcinoma. HCC hepatocellular carcinoma is the second leading cause of cancer-related deaths and account more than 80% of the primary liver tumors. So major challenge is the HCC is often diagnosed as the advanced stage, resulting in limited treatment options and poor diagnosis. There are many factors contributing to the HCC, which is NFALD, which is non-alcoholic fatty liver disease, metabolic toxicity, biological toxicity, and environmental toxicities. So the HCC tumor consists of many upregulated receptors are there, like upregulated factors are there, such as ALT, TAM, tumor-associated macrophage, TGF, and is highly angiogenic in nature, and also it is highly hypoxic. And however, There are some receptors which are useful for the therapy, such as asianoglycoreceptor, which is predominantly expressed in the basolateral membrane of the hepatocytes. It internalizes ligands through clathrin-mediated endocytosis and show high affinity for carbohydrate-based molecules such as galactose, arabinoglycan, and pullulan. Because of this natural binding preference, pullulan serves as an effective targeting ligand for the hepatocytes via ASGPR. The micro So this slides outline the rationale behind combining photothermal therapy with the immunotherapy for my study. So during PTT, heat-induced tumor damage released tumor antigens and damp. So these signals activate dendritic cells, which migrate to the tumor-draining lymph nodes and prime T cells, ultimately generating an anti-cancer T cells. For this study, I incorporated IR780, which is a cationic dye, near infrared cationic dye, and also to complement this study, I incorporated R848, which is a TLR7 agonist. So R848 activated dendritic cells, enhancing their ability to stimulate T cells. This creates a synergistic effect where photothermal ablation initiates immune activation and R848 boosts the downstream T cell response. So coming to the scheme of my study, so we chemically modified the pullulan. So then chemically modified the pullulan to a hydrophobic moiety. So pullulan is basically a polymer. Once the hydrophobically modified, I loaded IR780 and R848, which are hydrophobic molecules. So then I intravenously injected. So once it is in the bloodstream, it targeted the liver through the SGPR targeting receptors, and after irradiating with the NIR laser of 5 minutes with a power of 1.5 watt per centimeter square, the nanoparticle. So nanoparticle, here I given as a short name PIRNP. P means pullulan, I means IR780, and R is R8 for it. So induced a immunogenic cell death and also triggered a tumor-specific T cell immune response against HCC, thereby reducing the tumor burden. So this is an NMR spectrum of the thallic pullulan. Here it shows NMR spectrum that we successfully synthesized the thallic pullulan through the conjugation of the primary hydroxyl group of the pullulan and the carboxylic acid of the thallic anhydride. For the characterization of the nanoparticle, we have checked the FETM. So FETM reveals the morphology of the nanoparticle, which is spherical in the shape, and we checked the DLS of the nanoparticle, which shows that the nanoparticle which has a size of 150 nanometer, and the theta potential is negative, and also we checked the UV spec, so which confirmed the successful loading of the IR780 in the nanoparticle. Next, we evaluated the photothermal behavior and cumulative release profile of the nanoparticle. So we radiated the nanoparticle with 1.5 watt per centimeter for 5 minutes. So we can see that the temperature was increased in the final for the 5 minutes, and then we checked the cumulative release pattern of the nanoparticle. After the radiation, we can see that the R848 started releasing from the nanoparticle from the 28 hours to the 48 hours, like almost 80 to 85% of the nanoparticle was released. Then we check the cellular uptake behavior of the nanoparticle after the 4 hours of the treatment of nanoparticle with the HEPA-16 So we have seen that the nanoparticle is completely uptaken by the cells. So then we evaluated the competitive inhibition assay. We checked the competitive inhibition assay to evaluate the SGPR interaction. So we excessively treated the galactose with the HEPA-16 cells to saturate the receptors of the SGPR. We found that after the treatment, the nanoparticle is less uptaken by the cells since due to the receptors got saturated by the galactose. So then we checked the cytotoxicity and phototoxicity of the PAR nanoparticle on HEPA-16 cells. We can see that the nanoparticle is pretty safe. However, after the radiation, the nanoparticle kill almost all the cells, and we found the EC50 value also, and we have checked the live dead analysis to qualitatively analysis the cytotoxicity effect. So we can see that with laser most of the cells were dead. So next we evaluated the immunogenic cell death. During the immunogenic cell death, the CRT and HMGB are the key ICD markers. That's why we checked here. So CRT will translocate it from the endoplasmic reticulum to the surface, whereas the HMGB one will also translocate from the nucleus to the surface of the cell, which are the key markers of the ICD. So to further investigate the immunological effect of the formulation, we evaluated NF-kappa B expression in the BMTC. So we can see that final nanoparticle, which is PAR nanoparticle plus laser, which showed the highest expression of the NF-kappa B. This highest NF-kappa B expression was observed in the final group, suggesting that combining R848 with laser further enhances TLR78 activation, leading to the more robust NF-kappa B signaling response. Next, we check the biodistribution of the nanoparticles. So we established a HEPA16 subcutaneous tumor model, and on C57 BL6 mice, we can see that after 2 hours of post injection of the nanoparticle, the nanoparticle tends to accumulate, and subsequently the substantially increase reaching a peak at 6 hour post injection, which indicate the continuous and sustained accumulation of the nanoparticle over time due to its targeting ability. Subsequent imaging of excised tumor tissues and major organs reveal stronger fluorescent signals in the tumor compared to the organs in mice treated with IR70T. So this pattern of accumulation shows the excellent targeting ability of the nanoparticle for the SGPR on the tumor cell surface. So next we check the anti-tumor efficacy of the nanoparticle. So we can see that the final group irradiated with laser, PAR nanoparticle irradiated with the laser of power density of 1.5 watt per centimeter square for the 5 minutes showed completely reduce the tumor burden, whereas compared to the other control groups, the tumor was not completely grown, and so we next and there is no minimal body weight we are observed on the different groups, indicating the negligible impact of the treatment regime on the overall health of the mice. Then we access the cell apoptosis and its proliferation with the tumor. We conducted tunnel and K67 staining of the tumor sections after sacrificing the mice. Among the treatment, the PAR nanoparticle with laser demonstrated highest cell apoptosis and lowest level of cell proliferation. The biocompatibility and biosafety of the nanoformulations were comprehensively evaluated in vivo. So after the IHC, histopathological examination via HNT staining of the major organs of the mice after various treatment revealed no obvious lesions, and these findings substantiate investigated nanoformulation exhibited favorable safety profile. In addition, we also checked the hematocompatibility characteristics of the nanoparticle. So we also found that negligible hemolysis observed in blood samples taken from the mice. Again, we checked the CRT and HMGB in the in vivo tissues. So we found that elevated CRT and HMGB expression after our treatment. Then we checked the mechanism of anti-tumor response in vivo. So we analyzed the T cell infiltration, T lymphocyte infiltration, particularly CD8 T cells alongside. So we can see that after the treatment, the final group significantly increased the CD8 T cells, and whereas CD25 FOXP3, which is an immunosuppressive immune cell, which is significantly reduced in the final group after the treatment. So we also evaluated the macrophage, M1 macrophage and M2 macrophage. So M1 is inflammatory macrophage, which is significantly increased after the PR nanoparticle treatment with the laser, whereas the immunosuppressive macrophage, which is M2, is significantly reduced after the after the treatment in the final group, PAR nanoparticle plus laser group. So next we analyze the serum cytokine. So we can see that after the treatment, the final nanoparticle have significantly increased the IFN gamma and IL6 after all the treatment. So in conclusion, hepatocellular carcinoma remain a challenge in the malignancy with limited therapeutic outcome. So our nanoparticle, which is a PRN nanoparticle, provide efficient cellular uptake, controlled drug release, selective tumor targeting, and combination with the photothermal therapy and the TLR mediated immunotherapy induce strong immunogenic cell death and enhance anti-tumor immunity. This approach demonstrated significant promise for developing effective strategies for hepatocellular carcinoma. So I would like to acknowledge Professor Chongsecho and my professor Incupa and all laboratory members involved in this work. Thank you.